pleasure to welcome you on behalf of the Government of Kenya to this high-level ministerial dialogue on strengthening prevention, preparedness, and response to public health emergencies through amendments to the international health regulations.
This affects everybody on this planet. This affects all of our citizens, and it requires the attention of all of our political leaders in an open, transparent, and inclusive manner. So gatherings like this are all the more important this evening.
Nous sommes ici pour voir comment tous ensemble nous pouvons parler d'une seule voix et pouvoir suivre ce processus d'une manière collective. Quels sont les défis que vous avez rencontrés, mais surtout les opportunités et qu'est-ce que vous proposez pour que nous puissions avancer plus vite.
These amendments will strengthen the IHR to make it very effective. But we should also ensure that the IHR is more equitable, that it takes also the account of the specific needs of different countries, especially for our continent, and be able to include, to be able to provide some financial support to the countries to help them implement the IHR obligations that we outlined. But also very important is enabling developing countries to have greater voice and stronger voice in the decision-making processes.
With respect to our national experience on the IHR amendment process, Botswana has constituted a technical committee that includes representatives from relevant ministries and sectors for participation in both the IHR process as well as the intergovernmental negotiating body to develop a treaty. Like most countries in the region, one of the challenges that we are faced with is limited capacity to participate continuously and consistently in these important processes. Given the ambitious timelines, the meetings of the IHR and INB have been following each other, which places significant burden on our delegation.
In developing the Common African Position document, we should take into account the ambitious timelines that have been set for the completion of the three intergovernmental processes to ensure that the common position does actually influence the outcome of these processes. In order to adequately address the current shortcomings and to decolonize the system, we should maintain equity into the international health law regime. The Africa Group should be bold enough to push for the inclusion of provisions that require the transfer of technology to developing countries. Provision on collaboration in the area of research and development, capacity building in developing countries, and benefit sharing for access to genetic and biological resources are also of utmost importance.
We need to come to this point where we're looking at collective responsibility and collective action and ensuring that we're engaging, ensuring that all the amendments that we're making, that we fully understand and we're fully committing to them.
We are gratified by the position that Africa is taking to actually follow a common position in this negotiation. My urge to all of us is to ensure that our heads of state actually do attend the high-level meeting and also engage in the process between now and July before the declaration goes to the silent procedure, so that that negotiation is informed also by the negotiations from here so that they are fully aligned. Thank you, Honorable Moderator.